Hello, dear colleagues. Welcome back to our lecture series on botulinum toxin in aesthetic medicine. In this third lecture, we will go through the fundamental requirements and rules that form the backbone of every safe, effective, and professional injection practice. These may look like small technical details, but in reality, they are the decisive factors that separate predictable, high-quality treatments from risky or disappointing ones. Documentation is the first step. The patient chart must include identification data, age, medical history, current medications such as aspirin, and any previous aesthetic procedures. Each treatment must also be documented with injection points, the number of units, and the total volume applied. Photographs are absolutely mandatory. Patients often forget their pre-treatment appearance, and standardized photos prevent complaints and misunderstandings. Informed consent must be signed and dated. It should explain the expected efficacy, the limited duration of effect, and possible side effects. Finally, a treatment plan should be designed, making it clear that botulinum toxin requires repeated sessions, usually 2 to 4 times per year. Your staff also plays an important role. They should be trained not only in assisting the injection, but also in quality control, documentation, and patient communication. A professional and well-prepared team creates confidence and ensures a smooth workflow. Technical requirements are also critical. The treatment room should be bright with no shadows. The chair must allow both upright and reclining positions. For example, platysmal bands require the upright position, while glabellar lines may be more comfortable in reclining. A mirror helps the patient follow the discussion and understand which areas will be treated. A cosmetic marker should always be used to mark injection points before disinfecting. And finally, a standardized setup is essential. All syringes, gauze, disinfectants, consent forms, and photographic equipment must be within arm's reach. Now let us discuss the toxin itself: storage, dilution, and handling. Botox and Dysport must always be refrigerated. Xeomin can be stored at room temperature. If the cold chain is interrupted, the efficacy decreases. This can happen during shipping if ice or dry ice was not used, during storage if the fridge door was left open, or during a power outage without a generator. When you inject saline into the vial, the internal vacuum should automatically pull the plunger down. This is a simple but reliable test that confirms product integrity. If no vacuum is present, the toxin is spoiled and should not be used. For reconstitution, the standard dilution for facial indications is 2.5 milliliters of saline for both Botox and Dysport. For axillary hyperhidrosis, we use 4 milliliters, since wider diffusion is desired in that region. In contrast, for the face, excessive diffusion is dangerous. The toxin may reach unintended muscles and cause complications such as eyelid ptosis or asymmetry. There are also visual differences between the products. Botox vials look empty because the toxin is lyophilized and attached to the glass surface. Dysport vials, on the other hand, contain a visible white pellet at the bottom, which dissolves once saline is added. This is why Dysport must be reconstituted carefully. Never shake the vial. Instead, inject the saline slowly and gently swirl. Shaking creates foam, denatures the protein, and reduces efficacy. Let us now move to dilution and unit calculations, which is where many young colleagues get confused. Dysport example: 1 vial contains 500 units. If diluted with 2.5 milliliters of saline, the entire solution equals 500 units in 2.5 milliliters. When divided into 1 milliliter insulin syringes, this equals 2 syringes of 200 units each, plus 1 syringe of 100 units. In other words, 1 milliliter equals 200 units. 0.1 milliliter equals 20 units. 0.05 milliliters equals 10 units. So if you need to inject 10 units, you use half of 0.1 milliliter on the syringe. Botox example: 1 vial contains 100 units. If diluted with 2.5 milliliters of saline, the entire solution equals 100 units in 2.5 milliliters. That means 1 milliliter equals 40 units. 0.1 milliliter equals 4 units. This simple math ensures precise dosing. For beginners, marking the syringes with unit equivalents is very helpful to avoid mistakes. Why is all of this so important? Because improper handling has direct consequences. If the toxin is spoiled, patients will not face dangerous complications, but efficacy will be reduced. Instead of lasting 6 months, effects may fade after only 3 or 4 months. The patient may become dissatisfied. If they are not loyal to you, they might go to another doctor and complain that your injections did not work. You may lose a patient without even realizing it. To summarize the practical tips, always reconstitute slowly, let the saline enter gently, and avoid foaming. Always check the vacuum. No vacuum means the product is spoiled. Never shake the vial, only swirl gently. Communicate clearly with your patients about duration, cost, and expectations. Most dissatisfaction is due to poor communication, not to the toxin itself. Dear colleagues, in this lecture, we covered the requirements and rules of botulinum toxin treatment, documentation and consent, the role of staff and clinic setting, storage and reconstitution of the toxin, vacuum testing, dilution strategies, unit calculations for Botox and Dysport, and the clinical consequences of improper handling. By mastering these details, you ensure not only safe and effective treatments, but also long-term trust and loyalty from your patients. Thank you for watching. If you found this lecture valuable, please subscribe to the channel and like the video. In the next lecture, we will move closer to practical injection strategies. See you in Lecture 4.